Okay, this is the last chapter for cultural psychology. It's about mental health around the world. And mental health, you would think everybody's the same. We're all very close to each other as far as DNA is concerned. But the reality is, culture has a lot to do with why people um, have mental problems. And sometimes it's the culture that causes the mental problems. So that's what we're going to look at today. Lovely picture of somebody's neurons. That's the book that you're using. That's the Stephen J. Heine Cultural Psychology 3rd edition that we use. Psychological disorders are defined as rare behaviors that somehow impair the individual. The problem, what type of impairment is problematic, and what if a behavior that is rare in one context is not rare in another? Indeed, some psychopathologies are more prevalent or manifest in highly different forms across cultures. Experiencing a culture-bound syndrome generally requires one to have cultural beliefs associated with the syndrome. And of course, this is a question that I asked chapter 14. Some of you have already answered it. It's really kind of fascinating that you follow the taboos that you do because some of the Dene culture taboos are very much different from the general population in the United States. One of them would be not whistling in the dark. Another one would be not combing your hair at night, or you'll go bald. That was a curious one. I comb my hair all the time, and I'm going bald. Wait a minute. Dhat. This is one from India. Dhat is a morbid anxiety seen most frequently among South Asian males. That they're losing or leaking semen, and it is believed that the loss of sperm results in the person getting seriously ill. This often results from anxieties about disapproved sexual acts such as masturbation. The other problem is that in Southeast Asia, or Southern Asia, they also believe that you only have so much semen in your life, and if you waste it early in your life, then you won't have any for the latter part of your life. This dot would be a meaningless label in the United States. However, where there are no cultural beliefs about the vitality that sperm endows, and no cultural beliefs about the consequences of loss of sperm. Is it possible that other cultures suffer from the same psychological disorders as the West, but they don't have the same cultural beliefs associated with Western diagnoses, making them meaningless in other cultural contexts? And the answer is yeah, yeah. So some of the things that we talk about in abnormal psychology, um, just they don't equate in other places because their cultural contexts are completely different. Hikikomori is a condition in Japan characterized by living in an asocial state with no intimate relationships with anyone outside of the immediate family. It first appears in junior high school, and they end up reading books, watching TV, or playing games in their rooms. Indications are that the cause may be failure to succeed in a social world that has few options for those who don't fit in. Does not conform to criteria for any of the DSM-5 diagnoses. It has only recently become a cultural phenomenon and is now seen, although rarely, in other East Asian countries. Excuse me. Approximately one child per classroom in junior high and high school is afflicted with hikikomori, largely non-existent in pre-war Japan and uncommon in other cultures. It seems to have something to do with the internet and people becoming fascinated with the internet. And of course, this is a young Japanese girl who suffers from hikikomori. And as you can see, she's got a, I don't know what that is. That's one of those teddy bears with the hearts on their bellies. Anyway, hikikomori. Bulimia nervosa. Bulimia is uncontrollable binge eating. Individual then takes inappropriate measures to prevent weight gain. Absent in most cultures of the world, making it a culture-bound syndrome, especially in cultures where food is not abundant. And of course, they throw up their food. Eating disorders affect many people in the West, but there are some nuances when it comes to determining universality of these conditions. Bulimia appears to be a culture-bound syndrome because rates have increased over time, and the age of people being diagnosed with bulimia has gotten lower over the years. As a matter of fact, we have started seeing this in elementary school, not just in junior high and high school. It is also more prevalent in some societies, particularly those with Western influences, than others. In particular, it is absent in most cultures of the world, especially in cultures where food is not abundant. There is good evidence that bulimia is a culture-bound syndrome that occurs in the Western world, but not in any other aspect, and the Japanese, of course. And now we're starting to see it in China as well. Anorexia nervosa is an individual's refusal to maintain a normal body weight due to preoccupation with their body. Evidence of culture-bound status, a huge increase in rates of anorexia this century, primarily found in only some cultures. Evidence of universality, reports of self-starvation in numerous cultural contexts, but not due to body image. As with bulimia, rates of anorexia have significantly increased over time, and it is absent in many cultures. However, it has been found in cultures that have very little Western influence, and it also manifests differently in some other contexts as well. Symptoms resembling anorexia have also been noted among ascetics who refused food for religious reasons, and in the 17th and 18th century among teenage girls who starved themselves to model themselves after the ascetics. This historical record of anorexia, as well as evidence of anorexia in many non-Western contexts, have led some to argue that it is a universal disorder, although it may serve different functions in different places. For example, religious reasons versus weight loss reasons. And of course, this is Mahatma Gandhi. He starved himself to get England to do what he wanted them to do, and of course, he was relatively successful. Koro is morbid anxiety about one's penis shrinking into one's body. Primarily, it's found in South and East Asia. It is unclear what aspects of culture have led to the emergence of Koro. Koro-like symptoms have been found in some individuals in West African cultures, as well as in individuals in American culture who have had negative marijuana-induced experiences. Amok is an acute outburst of unrestrained, violent, and homicidal attacks preceded by brooding, followed by exhaustion and amnesia. Most common in Southeast Asia, it may result from having no acceptable means to express frustration. Amok. Hysteria, a commonly diagnosed condition in the 19th century Europe among women. Its symptoms include temporary blindness, insomnia, fainting, and loss of appetite for food and sex. Rates of hysteria diagnosis dropped dramatically in the early 20th century. Some think this is due to its being replaced by other diagnostic categories, while others think that it was associated with repressive Victorian cultural norms. Phrygophobia, the morbid fear of catching cold. This is largely found in China. People avoid cold air, eating cold food, dress with several layers. This disorder has been linked to other psychological disorders such as hypochondriasis and obsessive compulsive disorder. And as you can see, this individual is covered with clothes, many, many layers. Phrygophobia may be culturally linked to Koro, where that disorder causes male sufferers to feel that their penis is retracting into the body due to an insufficiency of male element, or yang. Male phrygophobia sufferers correlate coldness with an overabundance of the female element, or yin. Susto, a frightening condition in which a person thinks their soul has been caused to become dislodged from their body, causing a variety of physical and psychological symptoms. It's primarily found in Latin America. Voodoo death, a person is convinced a curse has been placed on him or her, or he or she has broken a taboo. Results in severe fear, reaction which may lead to death. It's mostly found in Africa, but it's also found in the Caribbean, where African slaves were brought over, and the voodoo was one of the aspects that remained from the African culture. It's also found in New Orleans. It's very common in New Orleans. Lata is a transient dissociated state brought on by a startling event, followed by an engaging in cultural inappropriate behavior, after which the person has no memory of the episode. It's found primarily in Southeast Asia, but also in Siberia and amongst the Ainu in Japan. Malgry is a concern that one has been invaded by totemic spirits that makes them sick, tired, and drowsy because they entered the sea or a new territory without having engaged in appropriate ceremonial rituals. It's identified among Aboriginal Australians. So if they go into a new area, a new territory that their Aboriginal group it isn't controlling, they have to go through a select ritual in order to be there. And of course, that if they don't do it, then they start suffering from Malgry. Agonias is an anxiety disorder that includes burning sensation, loss of breath, and sleeping. Among other symptoms, it's primarily found in Portugal and the Azores. The Azores are islands off the coast of Africa that belong to Portugal. Not surprising. Kufungis, Kufungisis is anxiety and somatic problems associated with mental exhaustion stemming from too much thinking, primarily found in Africa, Caribbean, and among American Indians and East Asia. It has to do with doing too much thinking. Ataques de nervois is feeling palpitations, numbness, and a rising heat sensation during emotionally charged situations such as funerals. It has been found in Puerto Rico. Attaque de nervois. Attack of nerves, actually. Universal syndromes highlight the biological bases of these psychopathologies. Still, prevalence and manifestations of these disorders may differ across cultures. The DSM-5 major depressive disorder, MDD, is diagnosed given 5 of the following 9 symptoms: depressed mood, inability to feel pleasure, change in weight or appetite, sleep problems, psychomotor change, fatigue or loss of energy, feeling worthless or guilty, poor concentration, and suicidality. MDD has been found in all cultures that people have studied. Prevalence rates appear to vary. Depression prevalence rates vary in the United States based on diagnostic criteria. The rate in China is about 1/5 that observed in the West. One proposed rationale for this is due to 2 different manifestations of the symptoms. Somatization, symptoms are primarily physiological, such as loss of appetite, and psychologization, symptoms are primarily psychological, such as depressed mood. Many Chinese psychiatric patients are diagnosed with neurasthenia. Neurasthenia is poor appetite, headaches, insomnia, and inability to concentrate. Neurasthenia was dropped from the DSM because symptoms were more physiological than psychological. If you look in the DSM-4-TR, neurasthenia is in there. In the DSM-5, it is not in there. Some have argued that most Chinese neurasthenia actually qualify for depression, even if only 9% of them report feeling depressed. Social anxiety disorder is a fear of acting in an inept, an unacceptable manner leading to negative social consequences, research has shown that East Asians exhibit more social anxiety symptoms than European Americans. Accordingly, evidence suggests that interdependence is associated with heightened social anxiety. However, social anxiety is less documented in East Asian countries. It has been documented universally, but counterintuitively, it is less documented in East Asian countries than in North American countries, despite greater concerns about social harmony and maintaining face in East Asia. Certainly, East Asians exhibit greater social anxiety symptoms, and there is some link between interdependence and social anxiety symptoms. In general, though, the rates of social anxiety disorder in North America and Europe are 14 times higher than rates in East Asia. The paradox between East Asians experiencing more symptoms but not meeting the clinical criteria for social anxiety disorder may be due to the differences in what behaviors are considered culturally normative. In Western cultures, the norm is for people to be extroverted. In East Asian cultures, the norm is for people to be introverted. That's not to say that social anxieties do not become problems in East Asian cultures. There is a culture-bound disorder called Taijin Fushu, or a fear of confronting others. It is a fear that is solicited by social situations such that one is concerned about how uncomfortable one makes other people feel, perhaps because of their gaze, body odor, or sweating. It is similar to social anxiety disorder because it is effectively treated using the same antidepressants as is used to treat social anxiety disorder. It has thus far been limited to Japan, China, and South Korea. The fear of being around people because of the fear that you stink, uh, or you're sweating profusely, or that you're looking at them too much. Suicide rates suicide rates vary dramatically around the world. Eastern Europe tends to have the highest rates. Muslim nations tend to have the lowest. Suicide rates also vary depending on one's age, with the elderly generally being more likely to commit suicide in most cultures. There is a special case in Micronesia in which there is a spike in the adolescent age group. This started primarily in the 1970s when a spate of suicides occurred among adolescent men over seemingly trivial problems with no obvious psychological issues to begin with. These suicides were also restricted to specific islands, particularly the suburban regions of those islands. Some have suggested that this spike was due to westernization of the island, leading to a loss of traditional roles for young men. And because they lost their traditional roles, they tended to commit suicide because they had nothing to do. And of course, here are the suicide rates all over. All over. There's the spike that they were talking about right there in Micronesia, and as you can see, Hungary has a high suicide rate. This is Japan. This is Micronesia, and this is the United States. Oh, there you go, Egypt. Egypt is the only Muslim country in this group. And as you can see, it's very uncommon for anybody to commit suicide in Egypt. Losing connection between one's cultural narrative and modern society, lack of cultural continuity, seems to put people at risk for suicide. Many First Nations bands do not have the strong sense of cultural continuity due to Western colonization. Many youths cannot identify with their traditional culture and are also unable to identify with mainstream Canadian culture. And this is something that we really need to talk about. The author of your textbook is Canadian, and a lot of times the Canadians brag that they have been better. They've been nicer to the Indigenous people in Canada than people in the United States were to the Indigenous people in the United States. But the reality is that the Canadians were fairly oppressive as far as the as far as the indigenous people were concerned, they're they started sending their children to boarding schools right after we started in the United States in the 1870s. They started right after we did, but they have a more oppressive system than we have in the United States. Our educational system in the United States is relatively flexible because each state gets to dictate what kind of curriculum they have. But in Canada, Canada, of course, in the 1870s was controlled by England, and England, of course, doesn't think of they want everybody to be the same. So the concept of education was English, and it was based on England. So that's what they tried to do with the indigenous people in the boarding schools in Canada. They tried to make them Englishmen, and of course the differences were far more extreme in Canada than they were in the United States, and for that reason, of course, they tended to suffer more in Canada, the First Nations people. Now, this is really controversial, mainly because the Canadians claim to be nicer than other people, that they're a lot more polite than Americans, and that they treated the indigenous people better. But the reality is, I'm sorry, it's not true. They also, when we talk about missing and murdered indigenous people in Canada, we're talking about a large portion of the population, a larger portion of the population that has been forced into prostitution in Canada. It's like half of all the trafficked women in Canada are indigenous, even though they're what 6% of the population. You know, half of the all the women that are trafficked are indigenous. I mean, that doesn't make a whole lot of sense. Of course, it's not anywhere close to that in the United States. It does happen, of course, but it's nothing close to that in the United States. Support of this argument has come from findings that bands with stable connections to traditional cultural past have lower suicide rates. Such a connection is indicated by negotiating a land claim with the government, possessing self-government, maintaining control over educational services, controlling their police and fire services, managing health services and cultural facilities. The more these indicators are present, the lower the suicide rate. And of course, these are all relatively common in the United States. We signed treaties in the United States. It was a lot easier to sign treaties in the United States because all you had to deal with was the federal government. The federal government was making all these treaties. The problem in Canada was that sure, you had a Canadian government, but the Canadian government couldn't do anything without getting approval from England. So in order to sign a treaty in Canada, they had to sign it with the Canadian government. Then it had to be taken over to England and ratified by the English before it could be accepted. And sometimes that would take an extended length of time. The United States, not nearly so much, because the deciding factor was closer, and it was far more common for treaties to be signed in the United States than in Canada. One fundamental hypothesis that researchers have found support for is that the lack of connection to one's cultural roots is a strong predictor of suicide rates. This is compounded by the fact that many do not identify with mainstream Canadian culture. Indeed, researchers found that the more that First Nations communities can connect with their cultural history, the lower their suicide rates are. The communities that have the most number of connections have suicide rates that are comparable with those of mainstream Canada. These connections include having its own policing or law enforcement organization, cultural facilities that promote a community's cultural history, having one's own political body, and whether or not a community is negotiating a claim to territorial land. And of course, now Canada is its own country, and it's a little bit easier for the Canadians to do this than in the past. But if you look at the suicide rates and you look at the health of the Canadian in First Nation people, the ones that are closest to the American the border with the United States, the ones who have relatives on the other side of the border are the ones that are the healthiest. So if you have a Nakota, the Nakota in the United States, and you have the Assiniboine in Canada, of course, the Assiniboine are a lot healthier because they can go back and forth, and it's a lot healthier in the United States than it is in Canada. Despite the universal prevalence of suicides, prevalence rates still differ dramatically across cultures. Motivations for suicide also vary greatly across cultures. Motivations in the West usually include substance abuse or depression. Motivations in Japan often deal with one accepting responsibility and or preserving honor. The cases of the First Nations in Micronesia suggest that different cultures have different motivations for suicide, and it may carry different meaning in different cultures. For instance, Japan has a long history of suicide playing an unusually significant role with the ritualized suicide method of seppuku, where they disembowel themselves. Schizophrenia is one of the most debilitating mental disorders and universally found around the world. There are relevant genetic factors, prenatal experiences, and neuroanatomical features, diagnosed given two or more of the following. And these are the following: delusions, hallucinations, disorganized speech, negative symptoms, and catatonic behavior. Schizophrenia is a disorder that is diagnosed when one exhibits two or more of these symptoms: delusions, hallucinations, disorganized speech, catatonic, or grossly disorganized behavior, and negative symptoms such as flat affect or loss of speech. There is good evidence of a genetic component of schizophrenia. One's likelihood of developing schizophrenia increases as the degree of genetic relatedness with someone who has schizophrenia increases. Despite its biological basis and similar incidence rates across cultures, some cultural variations still exists. That is, only 1% of the general population will develop schizophrenia. Having a cousin with the disorder leads to a likelihood of 2%. Having a sibling with schizophrenia increases the likelihood to 9%, and having an identical twin increases the likelihood to 48%. As one would expect with something that has a biological basis, incidence and prevalence rates are quite similar across different cultures. But notice that despite the role of genetics, there is still more than 50% chance that someone would not develop schizophrenia even if their identical twin with whom one shares 100% of the genes has schizophrenia. Subtypes of schizophrenia vary substantially. In the West, the rate of paranoid schizophrenia is as high as 75%, and the rate of catatonic schizophrenia is 1 to 3%. In India, the rate of paranoid schizophrenia is as high as 15%, and the rate of catatonic schizophrenia is 20%. So as you can see, because of the different cultural aspects, catatonic schizophrenia is far more common in India, and paranoid schizophrenia is very common in the United States. Also, patients in less developed societies have greater rate of recovery than in more industrialized societies. This is opposite of what one sees with other physical and mental pathologies. The cause of this difference is unknown. Some suggest that patients are more likely to remain members of a community in such societies rather than becoming homeless in industrialized societies. Interestingly, patients in less developed societies have greater rates of recovery from schizophrenia than in more industrialized societies, which is the opposite of what one sees in other physical and mental conditions. Explanations for this counterintuitive pattern include laying less blame on the patient due to his or her having less of a primary sense of control, having more positive associations with what the West considers to be hallucinations, and greater involvement of the community so that the person does not get left alone. Just as presentation and prevalence of psychological disorders vary across cultures, the same goes for how the disorders are treated. There is a tradition in the West of patients seeing a therapist and verbalizing their feelings and problems, likely rooted in the Western emphasis on self expression and being in a low context culture, among many other ideas discussed in this course. There is cultural variation in coping and seeking support. East Asians are less likely than European Americans to actively seek social support. This is due to concerns about how this will disrupt relationships with others. Instead, they rely on implicit social support, reminding themselves of the close relationships that they have. This may explain why East Asians tend to seek professional mental health treatment less than Westerners. Western treatment traditions can be traced back to Freudian times. Psychological problems are best treated by exploring people's memories and experiences. As treatment has extended into modern times, there is an emphasis on understanding the individual, his or her self discovery, and his or her cognitive biases. Freud thought that psychological problems were best treated by exploring people's memories and experiences because such problems were believed to be rooted in people's conflicts at an unconscious level, and the therapist should then interpret those experiences and memories. Carl Rogers then introduced the client centered approach, and other biological modes of thought have since been developed as well. But the common thread running through all the different therapy options is the client's ability to engage with the therapist. In contrast to the Western style, two broad categories of treatments can be seen elsewhere. Family centered, families seen as a key source of guidance and play an important role in treatment, and spiritualism and religion, construing psychological disorders as a problem with one's spirituality or a relationship with God or gods that went awry. In other cultures, healing practices are performed very differently. One of the most common practices is the role of families. They share the problems with the individual and also share the stigma and blame associated with whatever mental illness the individual has. Another common practice involves spiritualism and religion, which incorporates traditional healers such as shamans and sorcerers. Japan also has a couple of unique approaches to psychotherapy that reflect the cultural inclinations of Japan. The two are called Morita Therapy and Nikon Therapy. Morita Therapy is used to treat depression and anxiety. It does so by emphasizing secondary control, asking clients to accept the circumstances of their lives. The client must change their perspectives of the symptoms and learn to live productively in spite of those symptoms. To live productive lives, the treatment plan involves light manual activities such as sweeping, heavy manual labor such as chopping wood, and other forms of life training. Nikon therapy is used to treat people with depression and addiction problems. Clients are asked to reflect on their past, particularly on the kindnesses that they have received from others while thinking about how little they have offered in return for those kindnesses. Given the cultural diversity and prevalence rates of psychopathologies, one concern that has been raised is whether Western mental health treatments may sometimes do more harm than good. For instance, it's been argued that anorexia did not exist in the same form in Hong Kong until it was imported there. Similarly, post-traumatic stress disorder was not a problem in Sri Lanka after the 2004 tsunami until Western aid workers insisted that they must be suffering from it. And that is the end of the last chapter. And there is a lady suffering from anorexia who is from Hong Kong. As interesting as that is. So everybody stay safe and get everything done. Get your paper in.